Joining us now, Dr. Richard Besser. He's the former acting director of the CDC, now president and CEO of the Robert Wood Johnson Foundation. And we should also point out he happens to be a pediatrician. Dr. Besser, so happy to have you on this morning. I was just imagining parents this morning getting their coats on their kids, zipping up the jackets, heading off to the bus stop. And they're probably wondering, is this a good idea? What should parents be thinking about this morning?
Yeah, well, good morning, Hode. This is a really challenging time, and I think the next 6 weeks are going to be very challenging across the country. Thankfully, the Omicron variant is appearing to cause much milder illness, but just the fact that it's so contagious, I think it's going to make it very challenging for many schools to stay open. A lot of teachers, a lot of staff are going to come down with COVID, and whether schools are going to be able to remain open with a limited staff, with reduced staffing, we'll have to see. I think in terms of children themselves, what parents can be thinking about is whether or not your school is requiring masks, having your children wear masks. If your child has symptoms of COVID, anything that looks like a cold, keep them out of school and try and get them tested. I know it's very challenging to find test kits in many parts of the country. And if your child is in an age range where they are eligible for vaccination, talk to your doctor, get your questions answered. I really encourage parents to get their children vaccinated because that will reduce the chances even further that your child could have a severe infection with COVID.
So you mentioned anecdotally it seems less severe, the Omicron variant, than others. What is research and data showing in small children and those who are unvaccinated?
Yeah, so when you look at hospitalization, severe illness, it is far and away much greater among people who are unvaccinated. So getting vaccinated is a big plus. There are reports of increased hospitalizations in children across the country, but as people are diving into that, many of those hospitalizations are for other conditions, and children are tested and they're found to be positive for COVID, but they were in the hospital for other things, and so it's going to take a little more time to really tell what is the risk. But as you see skyrocketing numbers of cases, even a lower risk of infection, when that many people are getting sick, will put pressure on our healthcare system. So anything we can do to cut down on transmission will take the burden off our hospitals. When I think about our hospitals being full, taking care of people with COVID, I worry about people who are having heart attacks, people who have cancer, people who have kidney disease and need to be taken care of. So even with milder COVID, it can put strain on our healthcare system that could be really devastating.
So we have just come off the holidays. This is when everyone was packed in together. Is this going to be like the worst window where we are right now? And also, I was just thinking, everybody I know in this studio even knows somebody who has had it. Are we on our way to herd immunity when it comes to Omicron?
Well, we could be. I think these next 6 weeks are going to be really rough in terms of numbers of cases. But this could be the path out of this pandemic. As this variant spreads around and infects more and more people, hopefully the protection you get from having had an Omicron infection will provide some protection from other variants. The key, though, I think, to controlling this is focusing on global protection. We have done a terrible job at providing vaccines around the globe. And as we've seen with Omicron, new variants can arise anywhere. So from an equity and justice standpoint, we need to do more. But in terms of our self-interest in being protected against future variants, we have to do a lot more to make vaccines available to the entire global community.
And lastly, if you had a child who was getting ready to go to school this morning, would you send your child off to school?
I would. If my child had medical conditions that put them at greater risk, I would talk to my doctor about that. If my children were in the age where they would be vaccinated, they would be vaccinated going off to school. But I would send my children off to school. And if my school is taking this seriously and they've approached this with improved ventilation, they've approached this by mandating vaccination of teachers and staff and masks. If my school wasn't taking this seriously, I would be very concerned about sending my child to school.
All right, Dr. Besser, good advice. We thank you for being with us this morning. We appreciate it.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.